Namaskar. A very good morning to all the people who are joining online as well as those who are sitting here for the second day of this conference on millets. The first session is on millet consumptions and addressing public health challenges including malnutrition, anemia and diabetes. We have a very distinguished panel which is giving an opinion as also advice to people concerned. There are two or three things when you're looking at malnutrition in this country. People who are, lay people like me, we don't understand malnutrition, and I would urge or request some of the speakers to also make it convenient for the lay people to understand what malnutrition is all about and how millets can help. The second is the diseases diseases like diabetes, which are lifestyle diseases, and how millets can help eliminate some of those or the reasons or the causes of some of those diseases. कोशिश करूंगा मैं हिंदी और अंग्रेजी दोनों में बोलने की. हमारे पहले स्पीकर हैं डॉक्टर खेरा has already joined us. Dr. Ajay Khera is country representative of Engender Health. He is one of those people who has distinct advantage of having worked in this field, both as a government employee. He was commissioner in Government of India for more than a decade, looking at public health, looking at reproductive, maternal, newborn, child and adolescent health. He has also got some international exposure with WHO, both in countries like Myanmar and Oman. So both east and west of India, he has seen the world in that sense. Dr. Khera, possibly there are two things which we are looking at from your session, especially in terms of prevention of anemia. There are a lot of, when I was young and people used to tease me, you are so fair, probably you are anemic. And people don't realize that anemia has nothing to do with being fair or being dark, but it has more to do with the lack of iron content in your blood, perhaps. But that again is a layman's word. We would urge you to enlighten us in terms of prevention of anemia through consumption of millets. Dr. Ajay Khera, please.
Very good morning, Mr. Chairman, and on behalf of the Engender Health. And at the outset, I would like to thank the organizer, India Millet Initiative, SKN Agriculture University, and Indian Institute of Millet Research for inviting me and speak during this 2 days national seminar on millet and millet products at Jaipur. So very good morning to all of you, and talk about prevention and control of anemia and the role of millets. Before I talk about the role of millets, the problem of anemia, why anemia happens, and how may be aware that anemia is a silent public health problem. It is a silent killer. Actually, it's a silent public health problem where the hemoglobin content in the blood is reduced, and there's something called as the hemoglobin, which carries oxygen in the blood, and which is an indication of anemia. If the hemoglobin content of a person is less than 10 gram in the adult, we say that the person is anemic. And then there are different classifications. There is a mild anemia, there is a moderate anemia, there is a severe anemia. There are people actually where you find the anemia level even to the tune of 5 grams, 7 grams. But normally one should have more than 12, more than 13 gram hemoglobin. And particularly this is the problem of anemia. It doesn't make person sick actually. It doesn't make people go to the hospital. Person generally starts feeling weak. The person gets tired easily because symptoms of anemia are so vague and so non-specific that most of the people in the country do not give much importance, because you just feel tired, that's all. After some work, or even for students like adolescents, they also get exhausted while playing. But if the condition of anemia continues to increase, and if it goes to the stage of severe anemia, and sometime it may also lead to something called as the heart failure, congestive heart failure. And we have come across number of patients in the hospital setting where person with severe anemia reported as a heart failure. And particularly, I think you may also be aware that anemia is a problem which is across the life cycle. Problem in elderly across the life cycle. And in children, it is one of the reason for poor intelligence. And we call it in medical terms, poor, cognition. And this iron and this anemia is linked with the poor intelligence in the children. And the third important thing which I will highlight, that why we are talking about anemia in a big way, that during pregnancy it leads to poor growth of the newborn. If the pregnant woman is anemic, the newborn intrauterine growth retardation, poor growth of the children, newborn. And sometimes this particular anemia during pregnancy. So you can understand the range of implications. It's a very small problem. But if you look at the range of presentation, it varies from simple weakness to even death during. This is a problem which is a kind of a hidden problem, silent problem. You will obviously like to know how much is the problem. Is it so common? And you will be surprised to know, and you will be shocked to know that the burden of anemia in India is to the extent that every alternate woman in India is anemic. 50% prevalence of anemia in the women of reproductive age group. And 50% implies every alternate woman. And you can understand country with a 1.3 billion population with 50% women, you can understand the number of people suffering from anemia. And even in children, the problem is to the tune of 60%, even little higher. And even the adolescent girls, they also have a higher problem of anemia. Now, this is in compared to the male, where the prevalence of anemia is to the tune of 25 to 30%. So that means the women are suffering from anemia much more than the male. Another important point to note is that lot of efforts have been made by Government of India to address this issue of anemia, but over a period of time, the prevalence of anemia has remained same. I will talk about why it has remained same when we talk about the role of millets and the role of other nutrients in preventing and controlling anemia. Now, third important point which I would like to mention here is, as a policymaker, as a program people, or as a people interested in preventing anemia, let's try to find out the root cause. Because it's a very well-known saying that if you understand the problem, 50% of the problem is solved. Now, if I look at the root cause of anemia, why in India the anemia problem is so huge? One of the important reason is that increased blood loss because of any reason. And as you know that adolescent girls or the women who have a regular menstrual cycles, they lose blood and their requirement of iron is much more. They need to have more of iron. They need to have more nutrients to compensate for the loss. So blood loss is considered as one of the reason, not the only reason, one of the reason. And accordingly, one has to manage that blood loss. And second important point, which is important for this particular August gathering, is that decreased production of hemoglobin, because body is not in a position to manufacture or to produce adequate amount of hemoglobin which is required by the body, which is called as the normal hemoglobin. And particularly when we talk about production of the hemoglobin, there are a number of nutrients which are important. The protein content in the food is important, iron content in the food is important, and even other vitamins and mineral present in the food is important. And if the public is consuming less of protein, less of iron containing rich nutrient food, they are, that means less consumption leads to less production. What is attributed to this less production of hemoglobin? That means our people, our population is consuming, nutrition, food has a major role to play. Because you should be clear about, because every anemia is not treatable by food. Every anemia, because there are some medical conditions, the RBCs. I think you might be aware as a science students that we have in the body, in the blood, these red blood corpuscles contains hemoglobin, and there are medical conditions where because the your blood keeps changing. That's why it is recommended that one can donate blood after a gap of 3 months, because you are giving your blood is going to change after 3 months. But in some medical conditions, this particular RBCs get destroyed early, and there are conditions which are called as the hemoglobinopathies. There are medical conditions like malaria, there are medical conditions like tuberculosis, and there are many chronic medical conditions, even like of the RBCs, which leads to anemia. But the point what I want to convey here to this August gathering is that whatever I percent contributor is the less consumption of micronutrient containing food items. I'm saying is there are number of evidence, number of surveys, and there are number of markers, and there is something called as the serum ferritin level. Now, serum ferritin and some iron gets stored. So, and we have been able to demonstrate in one of the national survey which was conducted across the country, that is called as the Comprehensive National Nutrition Survey, which indicated, across the country, in different parts of the country, there is a real micronutrient deficiency ranging from 20% to 50%. Particularly, states like Haryana, Rajasthan, Madhya Pradesh, Gujarat, where you find anemia prevalence to be high. And the reason is because they are consuming more of a vegetarian food, and the non-vegetarian food consumption is less in this part of the world. So there is a more of, they need to consume more iron in comparison to the non-vegetarian population. And the scientific reason behind this is there is something called as the bioavailability of the iron. Whatever we consume, whatever foods we consume, there are foods, where bioavailability of the iron is much more. There are foods where the bioavailability of iron is less. And it is a very well-known fact that the non-vegetarian food has a food contains iron where the bioavailability is quite high. Now, because there is a micronutrient deficiency of iron, multivitamin, B12, folic acid, although the major reason is the iron consumption, but there are multiple micronutrients also contribute to this malnutrition or anemia, like deficiency of zinc, deficiency of magnesium, deficiency of folic acid, all leads to kind of a less production of the hemoglobin. Considering this particular magnitude of the problem, Government of India, launched actually under the leadership of the Honorable Prime Minister of India, under Niti Aayog, a big program which is called as the Anemia Mukt program, which has been launched under the Poshan Abhiyan, where Ministry of Women and Child Development Department, Ministry of Health and Family Welfare, and many departments have joined hands to make India free of anemia. And I really feel so happy to note that the Department of Agriculture, the Ministry of Food and Supply, the Ministry of Agriculture, they are also thinking in terms of supporting the government of India's efforts in making India free of anemia. And as per the government of India's initiative, considering the hugeness of the problem, they have come up with a strategy which is called as the 6x6 strategy. And I will not elaborate that 6x6 strategy, but there are three key thematic areas which are relevant for us to understand. And those three relevant areas are that the government of India said that the iron and folic acid is to be given as a supplemented iron tablet to across the life cycle to every woman in the country, every child in the country, every pregnant woman, every lactating woman needs to take supplemental dose of iron, which is called as the iron and folic acid supplementation. And I think you must have seen while the mother goes to a hospital, particularly during pregnancy, she is asked to take iron and folic acid tablet because they are not consuming adequate amount of iron and folic acid. Problem is so big. So we thought it might be difficult for us to change the habit of the people in terms of consuming better quality food. So then, the government of India decided by providing, iron and folic acid supplementation. But this iron and folic acid supplementation program is there for the last 50 years in the country. But somehow, the iron and folic acid coverages across the country, range from 10 to 20%. In spite of so much of efforts, if 10 to 20% of the population is consuming iron and folic acid, we won't be able to address this huge problem of anemia. And as you know that consuming medical tablet, people don't like taking tablets because people think if I start taking tablet, I'll start feeling that I am sick. People don't prefer to take iron and folic tablet, particularly if they feel weak, or sometimes mild anemia, they just feel tired. They don't feel like the importance of iron folic acid. And also the iron folic acid, when given as the tablet, there are sometimes side effects to some people. Some people develop nausea, some people develop vomiting, some people develop black stool, some people develop pain abdomen, some people develop diarrhea, because as you know that no drug is absolutely safe and there are side effects. And maybe side effects are self-limiting, side effects are there in 5 to 10% of the people, but you can understand if 1.3 billion people start consuming iron folic acid tablet and 5 to 10% developing side effects, people will not consume it, And people listen to their neighbors, they say, I took iron tablet, I had a diarrhea. So the another person won't eat it, take those tablets. So there are, lot of challenges in making the population consume iron and folic acid. So then the government of India thought that if this particular strategy is not enough, let's complement with other intervention. And the second intervention, which is being talked about, is the fortification, food fortification. There have been a lot of efforts by government of India in making the available staple food fortified with iron and folic acid and micronutrient. And there is a large number of programs have been launched where the wheat flour, even the rice fortification is happening, and even the salt is available, which is called as the double fortified salt, double fortified iron and iodine fortified salt, So there are efforts even in terms of the fortification, but there is a question of cost, there is a question of availability, and even with fortification, some people also there is a problem of palatability, acceptability. Their food, if the roti they prepare, the roti becomes black with the fortified food sometime, And even there is a problem of shelf life, transporting. You need machines to fortify food, It has to be a commercial channel, But then the third important approach, which very few people are talking, but I think this particular August gathering is talking, is, food diversification. We continue to talk about food diversification by changing the behavior of the people, by giving the right messages that please, diversify your food. Eat more food which contains more iron. So this is the third strategy. But I'm so happy to note that particular India Millet Mission has come up with this idea of, bringing millet on the forefront. And I was, going through this, available. I'm not a millet expert. I'm a doctor by profession, but I was going through the available literature on millet, and I was so amazed to find out the power and the potential of millet and vitamins help in improving the prevention of anemia. And I will like to quote some of this information which I've been able to capture. Systemic review carried out and meta-analysis conducted in 5 countries and 8 institutions showed by Dr. Anita that it helps in reducing anemia, diabetes, hyperlipidemia when the rice is replaced by millets. And even the iron availability percentage. So that means the bioavailability of iron in millet is just like equivalent to the animal food, near to the animal food, which is a great thing. If we really will be able to address this needs of the iron deficiency anemia, people continue to make a reference of anti-nutrient, so-called phytates in the millet. But the phytates are similar also available. But there are number of mechanisms, there are number of processing available iron in the millet. And even if we can do that kind of a processing of the millets in a scientific manner, and people like you who are expert in this, the increasing the bioavailability of the iron in the millet, this particular millet consumption of the iron. And we may not have to advocate iron country, and because that is the medical way of treatment, and the way if millet is promoted, if millet is spoken about, but it is not only just by saying. I think we might have to make efforts in terms of increasing the millet production in the country also, because I know that across farmers have reduced the production of the millet because people are not consuming. Even in the PDS government public distribution system, rice is available, wheat is available. People have stopped eating it. I know that in some of the high-end society, now millets are at this point of time. It is not the high fashion. I think it has to become the norm, which used to be there in the country. And therefore, I find that the millets can really, address. This could be a great contribution to the anemia mukt Bharat in India. So with these few words, I stop here, and thank you very much for this opportunity. Thank you.
Thank you, Dr. Khera. The 6x6 strategy which you mentioned about